Hello there everyone, many thanks to you for having joined us today on Aneke Television. Yes, of course, in the course of running the series, in order to celebrate democracy, this is the month of May, and May 29th will be marking democracy celebration in Nigeria. And of course, as we told you earlier in the previous series, that we are running a series to see the performance of the current administration, not just Nigeria, but as we are bringing it down home in Enugu State, the current administration under Governor Peter Mbah in Enugu State will be 2 years in office come May 29th. So today our searchlight is beaming on the health sector. And talking about the health sector, we actually refer to a very important agency within the health sector in Enugu State, the agency responsible for the organization, the management of the universal health coverage, talking about the health insurance policy of the state government for the people of the state. So that is what we'll be looking at on today's segment. My name is Chris Aneke. And of course we have joining us on the show the woman piloting the affairs of the Enugu State Agency for Universal Health Coverage, Dr Mrs Edith Okolo. It's a pleasure to have you on the show, ma'am.
Thank you, Chris, and good morning to our listeners.
You're welcome. All right, so to begin with, tell us, how has the journey been so far with the agency? You were saddled with the responsibility of giving the people health insurance, health coverage. So how has the journey been? When did you take off? And where are you now?
Thank you very much, Chris. It hasn't been an easy journey, but I must say that we've had the support that we require to make this journey a success. And by the support, one of the key things that make our work easier, and I will talk about what universal health coverage is. And so universal health coverage is something that the whole world have signed up to, including Nigeria. All the governments all over the world have signed up to it, to ensure that everybody is covered by healthcare. So that's why it's called universal healthcare coverage by the year 2030.
That's the target.
The target is to achieve universal health coverage for all by year 2030. And what is universal health coverage?
That's right. Go ahead.
Universal health coverage is about ensuring that everybody have access to health care, affordable and quality health care, to address the main issues that cause morbidity. So you're looking at treatment, diagnosis, and including palliative care. When we talk about palliative care, so it's not just a treatment. So let's say you've had a stroke or you've had a cancer, palliative care would be a supportive care. So it's not just having quality and affordable health care, but where you need it and at the time you need it.
Okay.
So that's why we say it's universal health coverage for all. Wherever you need it, whoever you are, and whatever it is that you need, you need to be covered by healthcare. And what is the driver for universal health coverage? The driver for universal health coverage is health insurance. Because it's easy to say providing universal health coverage for all, but then how do people pay for it? Particularly those people who cannot afford. The ones that are poor, the ones that are vulnerable within our society. How do you provide this affordable and quality healthcare for them? And the only way to do that is by having health insurance as a driver to achieving universal health coverage. And one of the prerequisites for achieving universal health coverage, in fact, the number one is political commitment.
Political commitment?
Yes.
So what's bringing politics in the picture?
Because governments have to do their bit. And without political commitment, you cannot achieve universal health coverage. That is why the governments all over the world have also all signed up to this commitment to deliver or to achieve universal health coverage for everybody by the year 2030. So what's in our own environment. What do we mean by political commitment? That is, what is the government doing to ensure that people have access, quality and affordable health care? So, specifically, we all know, first of all, if we look at His Excellency's mandate, what he said he is going to be doing, health is one of his top priorities. And it's not just what he said, but he's also doing it. So he's a man of his words. As soon as he came on board, he embarked on building what we call type 2 healthcare centers, one in every ward.
Across the 260 wards.
Across the 260. And if you've been, it would be nice for you to capture one of these health facilities. There are the state-of-the-art facilities. They have everything, including they're off-grid, so they can run without EEDC.
Okay.
Because they've got alternative power supply.
Independent.
Yes, they've all got water supply. They've all got the staff that they require. I mean, really state-of-the-art primary healthcare centers, one for each ward. And I think you should actually capture one of those and see, present it as it is. So not only that, he's also looking at human resources for health. So employing doctors and nurses, and if you don't have the right healthcare professionals, you cannot deliver quality healthcare. So in addition to infrastructure, he's also looking at human resources for health. He's doing something about it. So we know this is the political environment that we're talking about. Then he's also providing an enabling environment. So for example, we are running a program that we call the Basic Healthcare Provision Fund Program, which is funded by the federal government to provide healthcare for vulnerable persons. Okay. Vulnerable persons, we mean pregnant women, children under 5, aged people 85 and above, disabled persons, and then some really indigent population. And what is our governor doing to make sure that this program is working well? He's paying the counterpart fund.
So in partnership with the federal government?
In partnership with the federal government. You need to pay a counterpart fund, and our governor is doing that. So, like I said, universal health coverage is about providing quality health care. So, he's already providing the he's already demonstrating his political commitment by paying the counterpart fund as and when due, by providing the infrastructure, the healthcare infrastructure that you require, and also providing the human resources for health as well. So that actually is the fundamental, shall I say, the building block to ensure that you achieve universal health coverage. Because if you don't have the right human resources, you don't have the infrastructure, and you don't have the funds available, you cannot be talking about achieving universal health coverage.
And now has all of that, both the political will, both the infrastructure on the table, both what do you call it, human
resources.
The human resources. Yeah. So have all of that contributed to enabling you realize your mandate at the agency so far?
Yeah, definitely. Of course, we would like to be like Oliver Twist. Whatever we get, we want more. Okay, yes, we are getting what we require. We have the support that we require from His Excellency. But when you talk about healthcare, it is never enough. No government can say they've done absolutely everything they need to do for health. So we're always asking for more. We want more doctors, we want more nurses, we want more human resources for health.
More drugs.
Exactly, we want more drugs easily available to people. We want even more persons to be covered. More of the economy is very poor at this time, so quite a lot of people are struggling to pay for their health insurance premiums, and therefore that is where what you call the coverage for the vulnerable persons is very, very important. So you need more people to be covered because there are more and more people who are falling under the poverty line every day.
All right, we're going to pause it there. We need more and more people to be covered because of economic situation. Poverty, hardship everywhere. But we are not done yet. This is just the part one of this interview with Dr Mrs Edith Okolo. In the part two, we'll be delving more into the agency's activities, how far they've gone, how far have the people themselves responded to this opportunity provided by the state government in the last 2 years. So stay tuned, we'll be right back. This is Aneke Television. Okay there, viewer, you're welcome back on the part two of our interview. It is a series, as I told you, 2 years anniversary of the current administration in Enugu State, and we are looking at the health sector performance, but specifically at the Enugu State Agency for Universal Health Coverage, saddled with the responsibility of providing health insurance for the people. So let's see. So back to Dr. Mrs. Edith Okolo. In the part one of this interview, you were able to lay the background as to what the government has been doing around the health sector. But now I want to go specifically with the mandate of your agency, the health insurance provision for the people. How has it gone so far, especially within the last 2 years of this administration?
Thank you, Chris. So my agency has got a mandate to supervise and implement the Enugu State Universal Health Coverage Scheme, which is the health insurance scheme of the state. And so what is included in this implementation and supervision is actually getting people registered onto the scheme, so getting them to become aware of what the scheme is about.
Is it everybody, or are they targeted their population?
No, so it is for every resident of Enugu State. We actually know that health insurance is mandatory in Nigeria because there's a National Health Insurance Authority Act law of 2021, yes, 2021, which makes health insurance mandatory for all residents of Nigeria. So it is mandatory. However, we have not started enforcing it. It's still, people are still registering voluntarily. So our task is to enroll people, to register them into the scheme. So tell them about the scheme, register them, as well as paying for the health care. So we purchase health care on behalf of the people that we have registered into the scheme. So in order to purchase this health care, we also identify healthcare providers that meet the quality of care that we, standard quality of care. So we have healthcare providers that are both state government owned and private healthcare providers. We have private healthcare providers as well. So we register people and we purchase care on their behalf. So those are the two major tasks that we do.
So with the registration, how far has it gone?
With the registration, we've actually registered about 199,000 persons
in the state.
In the state, not every one of them have paid, but a good number of them have actually paid. But this 199,000 that we have now, we had an increase. So within the last 2 years, it was increased by about 29%. So it was much less 2 years ago, but within the last 2 years, it has increased. And what we're doing is, like I said, we enroll the people. We either register them when we go for enrollment drives to communities to register them. We work with the community stakeholders, their Igwes, their PGs. We inform them we are coming on a particular day. The people come out, we enroll them. The other ways that we also enroll them, we do also enrollment drives to the major hospitals, major health centers in Enugu, like Polyclinic, Azata, Park Lane Hospital, Wani General Hospital. We also work with our stakeholders in the markets. We've gone to market associations, we've gone for enrollment drives in markets as well. And then people can also walk into our office to get them registered. One of the new things that we've introduced now is we now have an electronic enrollment form. So when somebody contacts us, we send them that enrollment form, which they will complete and will return to us. So they don't actually need to physically come to the office. It can be done off-site.
All right, so what does it take for one to get registered into the scheme?
All it takes is being a resident of Enugu State.
You don't need to be a politician.
You don't need to be a politician.
So what does it take?
So exactly what I've said, you either